Hello everyone. Do you know that around 40% of fast bowlers develop an injury to the shoulder and elbow during the season and obviously during the practice? Would you like to know how you can prevent them and what is the treatment option for these injuries? So stay tuned. So guys, welcome to our channel. This is of the shoulder and knee clinic where we focus on various shoulder, elbow, knee injuries, hip injuries, sports injuries in athletes. We talk about various treatment options and how we can prevent them. So, if you like our channel, do share, like, and subscribe. We have been doing this since the past 15 years, and we have treated a number of athletes who are actively playing in various leagues and so on and so forth. So, coming to today's topic, essentially we'll talk about shoulder and elbow injuries in bowlers. So common actions, especially the cocking up phase where you take your arm behind to generate the force when you're throwing, that is one of the most important things which can lead to your shoulder injuries. If you don't have good trunk as well as core stability and your lower limb biomechanics are not correct, the pattern of your landing is not correct, then it is very likely that you may injure your shoulder and elbow. So, how do we, prevent this? So, the thing is, when an individual starts bowling, that is typically at a younger age, in adolescent age, the shoulder undergoes a compensatory change. You'll have to get an arc of movement so that the hand goes behind to generate the pace. So, that leads to a compensatory adaptation in the shoulder where the anterior or the front structures become a bit loose and the structures at the back of the shoulder become a bit tight to compensate for that. As a result, the arc of movement of the shoulder changes. So that is known as a compensatory change. When there is a difference between the bowling arm and the opposite side more than 20 degrees, it's called a glenohumeral internal rotation deficit. So essentially reaching behind like this will not be same on the bowling arm compared to the other side. Now, over a period of time, this can lead to issues in the shoulder. So, the long head of the biceps, especially in bowlers, it prevents a peel back effect on the labrum. So, if you see the glenoid, on the superior aspect of the glenoid, the long head of the biceps is attached, which will resist any peel back forces on the labrum. If an individual has this compensatory change due to bowling and over a period of time the shoulder also starts decompensating, then it can lead to peel back phenomena, it can lead to tears of the long head of the biceps known as slap lesions. This is probably one of the most common injuries seen in overhead athletes and bowlers alike. So typically this will cause pain in the shoulder because of the altered biomechanics. The rotator cuff can also get pinched between the humeral head as well as the glenoid, causing pain in the shoulder. Most importantly, they will feel that they are not able to generate the force when they are trying to bowl. Pain will not be very severe, and on restriction of activity, generally the pain will disappear. So it's very, very important to prevent these injuries. Now obviously they are not career threatening injuries, but they can restrict your bowling and the force you can generate in the shoulder. So most important thing is to prevent these injuries is, one, to improve your core stability, truncal strength, lower extremity strength. Second, upper back strength. Then there are exercises known as sleeper stretches with which you can stretch out the posterior capsule of the shoulder, which can improve the balance in the shoulder, decreasing the risk of the injury. So in this image we can demonstrate the sleeper stretch where you sleep on one side and gradually try to touch the palm to the bed while keeping your elbow bent at 90 degrees. So this is one important thing. Before starting bowling, always warm up, get your joints loose so that you are in a good position to start bowling. Now, what are the warning signs? Essentially, you get pain in the shoulder, you feel that there is no adequate strength, you are having symptoms like difficulty in lifting on the side. So these are all the signs that there is some issue in your shoulder, and you need to see a specialist shoulder surgeon for this. Now there are many treatment options for this, which we'll discuss later on separate videos. So most important thing is pre-season and during season, work on your core stability, strength, do your sleeper stretches to decrease the risk of injuries. Also, keep an eye out on our channel, because in our next video we will discuss a very interesting case of Mr. Rahul, who had an issue of a labral tear and was not able to play sports. So if you have any questions regarding what we discussed today, do drop a question in our comment section. We'll be glad to answer that. Do share, like and subscribe to our channel, and stay tuned. Thank you.